I was sweating. I had a fever. I was nauseous. I kept thinking I was going to throw, I couldn't eat. I was in fetal position the whole time. It was horrible. And he said, no, he said, this is endometriosis. It'll eventually get better. And I'm like, are you freaking kidding me? Like, this is the worst pain I've, like, childbirth was like easier than this. I mean, that's how bad it was. Hi, I'm Kristin. I'm from Fresno, California. And in July of 2021, I was diagnosed with stage 2 colon cancer. I have always struggled with IBS. I feel like most people struggle with that. And I struggle with that since I was in my teens and just always at the doctor with stomach issues. And I don't know if that was kind of a precursor to my diagnosis, to my symptoms. I don't think it dates way back then, but I just struggled with digestive issues pretty much my whole life. And in March of 2021, I started experiencing more difficult or uncomfortable IBS issues before, when I'd struggle. Sorry, I'm going to get a little TMI, but it was just, I'd eat something and then I would just be straight in the bathroom. But and that was pretty much my whole life. And then bloating and uncomfortable, just stomach feeling, everything I ate. Didn't matter if it was a piece of toast, a banana, whatever. I just was super uncomfortable all the time. And in March of 2021, all of it just seemed to just completely intensify. And I went from being in the bathroom all the time to not being able to go to the bathroom. And that was so out of the ordinary for me because that was never an issue. The bloating was even more significant. And then what really set it off was I started one day, I remember exactly the day I was working out at home, and the right side, bottom right side, where your appendix is, started to hurt. Just boom, out of the blue. And I thought, oh shoot, did I pull a muscle? And so I just kind of like wrote it off as, oh, I must have pulled a muscle because I was lifting weights, whatever. And then a couple of days go by and it didn't go away and it was getting worse. And then I started thinking, oh my gosh, maybe it's my appendix. And so I went to the doctor. They sent me right in to get a CT scan. And the scan showed that my appendix was fine. But what they did see was I had heavy fecal load in my colon. And so they just said, you know what, go and take a laxative, whatever you need to do, clean yourself out. It should go away. That's the problem. And so I did. And the pain really didn't go away. It just kind of lingered for a bit. And so I was kind of like, oh, maybe it's my gallbladder, and just, kind of like wondering what this is. And then it just went away. And so I thought, okay, well, whatever that was, hopefully it doesn't happen again, because it was really, really uncomfortable. And that was that. And so I just kind of chopped it up as having just some major just stomach issues, like a really bad flare up with my IBS. And then, but after that, my stomach just never was the same. Like, I would take a bite of anything and my stomach would just bloat up and I would be so uncomfortable and it just didn't feel right. And then at that time, I started gaining weight. It was really weird. I didn't change my eating habits. I was working out. But it wasn't like regular weight gain. It was almost like bloating in a way. Like my face felt, puffy. And now looking back, I really believe that it was just inflammation that was going on in my body because I had the cancer growing inside me. So fast forward after that first incident in March of 2021, the end of June of that same year, that pain started coming back again. and freaked me out again. I'm like, oh, great, here we go again. And I knew it wasn't my appendix because it was the same thing that happened last time. I knew it wasn't, like my gallbladder or anything like that because the scan showed that that was all good. And I had talked to my sister about what was going on, and she struggled with endometriosis, and she had a full hysterectomy when she was in her early 30s. And she goes, your symptoms sound a lot like the endometriosis that, I struggled with. And so she gave me the name of her doctor. He's a hormone specialist, and he had been doing his line of work for over 40 years. She's like, he's really, really good. Go see him. Maybe it's endometriosis. And so I got in with him right away, went through a whole appointment. He did a physical exam, didn't do any blood work or anything like that. But just from my symptoms that I was telling him about and the exam that he gave me, he said, I am 99.9% sure that you have a bad case of endometriosis. Your sister had it. I guess it's a genetic thing. I don't know. And so he diagnosed me with it. And I said, this pain is horrific. I'm done having kids. What can we do to get rid of it? And he said, well, we can schedule a hysterectomy. I mean, we went to that extreme. Like, I was in so much pain at that point. And this is all of this was in like a 2-week span. And it was just progressively getting worse. And so I called that doctor. By the time I got into his office, I was begging him. I said, can you please get me in like tomorrow? Like, this is an emergency. I was sweating. I had a fever. I was nauseous. I kept thinking I was going to throw. I couldn't eat. I was in fetal position the whole time. It was horrible. And he said, no, he said, this is endometriosis. It'll eventually get better. And I'm like, are you freaking kidding me? Like, this is the worst pain I've, like, childbirth was like easier than this. I mean, that's how bad it was. And so he just kind of sent me home with more medication. And that night I started throwing up, and I just couldn't, like, I remember I was on the phone with my husband, and I had to just, like, I was talking to him, and all of a sudden I just got sick. My husband took me to the ER, and they did like an ultrasound, and they saw all this fluid, and they're like, oh my gosh, it must be your appendix, because they couldn't find my appendix. It must have ruptured. And so they admitted me. And after they admitted me to the hospital, then they did a CT scan, and they said, oh, you've got this like really large mass, and you have an obstructed bowel. And so then it went from ruptured appendix to a bowel obstruction. Maybe that mass is from your appendix that ruptured, because we still can't find it. They put an NG tube in my nose. It was the worst thing I've ever experienced. And was in the hospital for a few days, and they did an MRI. They were hoping that the NG tube would take all that fluid out, whatever it was, and get rid of that mass. And after a couple of days, they took me in for an MRI. That mass was still there, and nothing was getting better. And so they took me in for emergency surgery. And they brought in, just to be on the safe side, they brought in a cancer surgeon to do the surgery. And also the doctor that diagnosed me with endometriosis was also sitting in on the surgery, because he was just at that point, he's like, well, I might as well just do the hysterectomy at that time. And so when I went in for the surgery, they said, we're not sure if you're going to, need a colostomy bag. So I went in there just not knowing what the outcome was going to be, because it was so bad. They had to fully open me up. And all I cared about at that point was getting the NG tube out of my nose. I'm like, I don't care what you have to do. I just want this thing out of my nose. It's the worst thing that I've ever experienced. And went in for surgery, and I didn't need a colostomy bag. They had to remove the entire right section of my colon. They removed a 5-centimeter tumor, which was the size of my hand. It was wrapped around my right ovary, my right fallopian tube. So they had to remove both of those, part of my small intestine was perforated. So they had to repair that and remove a small portion of that. And then they also had to peel the tumor off of my stomach. When I talked to the surgeon the next day, he said it was just complete chaos in there. And he said if we had not operated when we did, and that small intestine would have torn just a little bit more, it would have been a whole different story. And so I said, well, did you do a hysterectomy? Because was this all caused by the endometriosis? And he goes, you don't have endometriosis. There was nothing. I'm like, are you kidding me? And then, of course, my next question was, is it cancer? And he said, we don't know. We sent it to pathology and we'll let you know. When he told me it was colon cancer, he said, but the good news is, the tumor, it was fully removed. The margins were clean. And I also found out that the cancer surgeon removed 40 lymph nodes during the surgery, and all of the lymph nodes came out clean. He said, so that's all great news. We just need to find out what stage it is and, what the next plan will be or the next step will be. And so I was in shock immediately and then angry. Just my mind immediately went back to all the years of my stomach issues, and why didn't they ever, if I had so many issues back then, why didn't they ever have me do a colonoscopy just to make sure, or an endoscopy or whatever, just to make sure that there's nothing going on. And then the misdiagnosis of endometriosis, I was angry. But then I remember my dad, he came up to me and he put his hand on my shoulder and he goes, you're going to be okay. And it was like, just like that, I snapped out of it. And I'm like, all right, whatever's going to happen is going to happen. I'm good. I know I'm going to be okay. The oncologist called me a few days later and he had me come in and he said, it's stage 2. So it's up to you whether or not you want to do chemotherapy. So in October of 2021, I started chemo and I did it for 4 months. So how it looked was I would go in for a treatment and then they would hook me up. So they would have me do 2 of the chemo meds there at the infusion place. And then they would send me home with a pump. So they would hook me up with the final, and I cannot pronounce any of the names of the medications. All I know is they were gnarly. But so they hooked me up to a pump, and I had to wear, a little fanny pack with the rest of my chemo in it for 2 days. That meant no showering for 2 days, and it was crazy because the first time, so when I started the chemo, I was still recovering from the surgery. And that was really, really hard because I got an infection from my incision. So I was hospitalized again. And and this is so TMI, but it's colon cancer. I was in the bathroom 12 to 15 times a day. So I was severely dehydrated. I started losing weight drastically. And, one of the chemo meds that they had me on causes diarrhea. And so my oncologist was like, you got to get yourself, feeling better. But I wasn't. And so I went into the chemo treatment still struggling from the surgery. And so that, I think, made the treatments even worse for me. So the first treatment that I received, within 2 days, I got the most intense, excruciating mouth sores all over the roof of my mouth, my cheeks, my tongue. I couldn't even drink water. They were so intense. I don't want to go into too much detail, but they would bleed. And it was from one of the meds. I just had a horrible reaction. And, I know from what I've heard that mouth sores are very common with most of the chemo meds. But when, like, my girlfriend, she was, one of my best friends, she was going through cancer treatment at the same time for breast cancer. And she was able to have like popsicles and, cold things during her treatment to help keep her, in ice chips and things like that to help prevent the cold sore or the mouth sores from happening. But I couldn't do that because one of the meds that they had me on caused neuropathy. And so for 7 days after I would have my treatment, I couldn't eat, drink, touch anything cold because I got neuropathy so bad in my throat, in my hands, and in my feet. And the throat was the weirdest thing. And so everything that I had to ingest, touch, whatever, and still to this day, when I brush my teeth, I do it with lukewarm water. Like I still have a hard time with putting anything cold in my mouth. So that's the reason why I got the mouth sores so bad. And so that was like, boom, right off the bat. And I was thankful to not have one of the side effects be hair loss. I'm not going to lie. I mean, there were moments where I was like, okay, this is it. This is my life. I'm never going to feel normal again. I'm always going to feel this way. I'm always going to feel weak, run down, just awful, and that was so not who I was. I hated not doing anything. I was always doing something. And so this forced me to ask for help. And we had wonderful people making us meals and bringing us meals. And, it was a beautiful time, even though it was a dark, horrible time, but it was a beautiful time because we had our friends and our family just really rallied around and helped take care of things. And it was nice that, my kids were older, so they weren't so dependent on me having to make them meals and that stuff. And my husband, he was just wonderful. My mom was the one who would take me to my doctor appointments and drop me off. My husband was the one that took care of me at home. But they wouldn't say that there's no evidence of disease until after I was done with my treatment. So my last treatment was January 26, 2022. I consider that the day I was cancer-free because that was the day they took the pump off. I rang that bell and I told myself, I am done. I'm cancer-free. But it wasn't until I got my scan in February that they officially told me there's no evidence of disease. And so, yeah, I've been cancer. I just celebrated 3 years a few weeks ago. And I know I'm doing good. It's so funny. I was telling my husband, I said, it took like 3 years for me to finally like feel fully human again. You don't realize just what chemo does to you. It hopefully gets rid of the cancer, but then it also is like just completely destroying your body, yeah, and then that's another thing. They don't really necessarily prepare you for the after you're done with treatment. My life will never, ever be what it was pre-cancer. My outlook on life is completely different. I feel blessed. I have so much gratitude, but then at the same time, I always in the back of my mind think like, oh, what if it comes back? You just kind of struggle with that. And I can't do that because it's just, and I have to tell myself like, stop, like you're good, you're healthy. If it happens, it happens and we'll deal with it at that time. I have to literally take it. It's like people that are in recovery. You just have to take it from like addiction and alcoholism. You have to take it one day at a time. You can't, it's kind of the same thing. My husband is a recovering addict and I'm recovering from cancer. And I almost feel like we have so many similarities where we have to take it one day at a time, and we can't focus on the past, and we have to really focus on keeping ourselves as healthy as possible. It's so crazy because my best friend, Felicia, in 2018, she was diagnosed with breast cancer. And I had gone to her appointments with her. And, I was there with her and going through, and I went to some of her, treatments with her and just kind of being like that big cheerleader for her. And it had gone into remission. And then less than a year later, her cancer came back, and it came back stage 4. But she was going to, at that time, her oncologist was like, this is still very treatable. You can still live, a good life. We just have to keep it under control. And so I was back at it with her, going to her appointments. And then a year later, I was diagnosed. And they ended up putting me with an oncologist that was on the same floor as hers. And so we'd sometimes have appointments the same day. And I just remember the day that I got, she knew I was going in for a scan. And she knew I was going in to get my results. And I knew what my results were going to be. I knew they were going to say there was no evidence of disease. And they did. And so I was so excited. I wanted to tell everyone, but I didn't want to tell her. And she called me and she's like, okay, what'd they say? And I just like downplayed it, like, oh yeah, there's nothing there, and she was just over the moon, so happy for me. And it made me just feel so bad because I knew that she was never going to get that news. I knew that her cancer could go into remission for a little while, but I knew it was just only a matter of time it was going to come back. And, she fought for a couple more years and in and out of the hospital. And she really fought. And in April 5th, 2024, she passed away. And I was there with her. I sat with her the whole time she was in the hospital. And I was there when she took her last breath with her family. And I know she's in a much better place. But man, and even when I go to my oncologist, to the cancer center, for my appointments, I go in there knowing I'm okay, I'm healthy, but I'm going in for my treatments, and I see the people in there that are not. And that's really hard because I'm so grateful that I got the second chance and that we caught it early enough, as ugly and as disgusting as it was going in, thinking it could have been so much worse, but it wasn't. We caught it early enough. And I was able to get that second chance, but there's so many that do not. And that's hard for me. We are our biggest advocates, and we have to, it doesn't matter what the doctor says. I mean, it does matter, but if a doctor says, no, you're fine, or no, it's not this or whatever, and you feel in your gut, in your heart, in your soul, in your whole entire body that, no, I know what I'm feeling, you have to push it. You have to fight for it. You really, really do. I mean, you do. And, if you do get that cancer diagnosis, it doesn't mean your life is over. It doesn't. There is so many treatment options nowadays, not necessarily chemotherapy or radiation. There's the immunotherapy, there's the whatever it is. Mindset. I really believe mindset has a lot to do with, how you get through the whole process. And because you get that diagnosis, no matter what stage it is, it does not mean your life is over. It means it's time to fight. whatever that fight might look like. And it's worth it. It really, really, truly is. I'm so glad that I went through all that I went through, because it showed me that even in my weakest moment, I was so strong. My body was strong. My mind was strong because I got through it, and I guess my message is if you do get that diagnosis, don't give up. It doesn't mean the end.